Well, good morning. Thank you for coming. I'm joined here today by Audrey Morris-Gasteyer, Executive Director of the Massachusetts Health Connector. I wanted to be here because I wanted to let you know about where we stand on health care. This summer, President Trump and Congress passed legislation that took away $1 trillion in health care. That's had big impacts on everyone in every single state in this country. Everyone's premiums have gone up. Every hospital, health center, and nursing home is hurting. It's harder to get doctor's appointments. People are losing care, and it's putting at risk access to care and services that people need. Now, what's making this even worse is that Donald Trump is canceling the program that allows nearly 400,000 Massachusetts residents to have health insurance. Here's what I mean. Under the Affordable Care Act, people have been able to buy health insurance the last few years through the Health Connector program here in Massachusetts, through a marketplace. These plans have been subsidized by tax credits that have been made available to people. Earlier this year, President Trump and the Republicans in Congress refused to extend these tax credits. So as a result, this program that provides health insurance to nearly 400,000 people in Massachusetts and hundreds of millions across the country is going to expire the end of this month. Now, let me tell you who we're talking about, okay? Of the 400,000 people, a lot of them are small business owners. They're people who are self-employed. They're middle-class families, single parents, all across our state. But unfortunately, because of President Trump and Republicans in Congress, these tax credits are going to expire, and people are essentially going to lose their health care coverage. I mean that because what's going to happen is, without these tax credits, people are going to see their health insurance costs go up, double, triple. Some families are going to find themselves paying as much as $25,000 a year for health care coverage. Nobody can afford that kind of increase. Nobody can afford that kind of increase. So these disastrous price increases go in effect in less than 3 weeks now. And as a result, we're going to see Bay Staters all over the place effectively lose their health care, lose their health care insurance. I've repeatedly called on President Trump and Republicans in Congress to act. All they need to do is just take a vote and extend these credits for some amount of time. Because if they don't, people are going to suffer. People are going to go without care. It's totally unaffordable, it's totally unacceptable, and it just doesn't need to be. I really worry about the woman right now who's getting treatment for breast cancer. What's she going to do when these rates go up? She's not going to be able to afford it. What do we say to people with heart disease right now who are going to lose access to their treatment and won't get the care that they desperately need? Our kids who need access to medications for asthma and other things. I mean, at the end of the day, people here in Massachusetts and around this country, because of what Donald Trump has done and because of what congressional Republicans have done, are going to lose their health insurance. It's just not right, and it just doesn't need to be this way. So there's still time for Washington to fix this. There's a vote this Thursday. This Thursday, senators will be voting on whether or not to extend health care for Americans. I call on them to vote to provide this health care coverage. And I call on President Trump, who, by the way, is making a speech, I think today. All he needs to do is direct them to provide this health insurance, to not take away health care coverage from millions and millions of Americans, including those here in Massachusetts. It's very simple, and my message to President Trump and Congress is simple. Do your job, fix this, and protect people. Protect people by making sure that they continue to have health care coverage and that their costs not go up. People can't afford health care coverage as it is, and President Trump needs to take action to keep costs from going up if he cares about affordability, and to ensure that people continue to have access to this health care coverage. I've also looked at what we can do as a state to help people in this current moment. I've directed Director Gasteyer to go to D.C. tomorrow She will be testifying before Congress on this issue to lay out the impacts here in Massachusetts, so that no one in Washington can say that they don't know what's happening and that they don't know the impact that this is going to have on Americans around this country, and that it's up to them to do the right thing. The other thing I've done is, because I'm going to do all that I can here in Massachusetts to help residents deal with the current situation. I'm doing this because lowering your health care costs is important to me. I want to lower your health care costs and do everything I can to do that, even if the President and Congress are going in another direction. And I want to make sure that you and your family have access to the care that you need. That's why earlier this year, I capped deductibles and copays for the first time in our state's history. We've set up a website right now that you can go on if you're one of those 400,000 people out there facing this devastating cliff in just 3 weeks. You can go to the Health Connector website. We set up a portal there, and you can understand your options. They're laid out for you and your family. And we have people standing by who are ready to help you and ready to help you navigate this current landscape. But the most critical thing in this moment is for President Trump and Republicans in Congress to act and to vote on Thursday to extend these credits so that people's health care does not get canceled in this country. And I ask everybody to call on Republicans in Congress and in the Senate to vote on Thursday to save health care, to protect Americans, to protect people here in Massachusetts. Tell them to extend those health care credits. It's that simple. Tell them to do their job, get it done. People are dealing with enough uncertainty and anxiety, and every day I am focused on affordability, driving down housing costs, energy costs, and yes, health care costs. And I hope that the President, when he makes a speech today about affordability, does the simplest thing he can and make sure that costs not continue to go up when it comes to health care, simply by directing Congress to vote to extend these tax credits. I'd now like to call up Director Gasteyer to say a little bit more.
Good morning, and thank you, Governor Healey, for your leadership and continuing to urge policymakers in Washington, D.C. for an extension of the premium tax credits that make health insurance affordable and care accessible to hundreds of thousands of Massachusetts residents and millions of Americans. At the Health Connector, we are 2 weeks away from our biggest deadline of the year. December 23rd is the last day that residents can enroll in a plan to start January 1st. For both existing enrollees and new applicants, starting the new year with coverage is a priority, and we will be busier than ever over the next couple of weeks. The primary reason for the increased activity this year is the lack of action by congressional Republicans and President Trump to extend the enhanced premium tax credits that keep health coverage affordable for 22 million Americans, including over 330,000 people here covered through the Health Connector in Massachusetts. Having affordable coverage is the bedrock of financial security, which matters more than ever. It means you can get the care you need if you have an accident or unexpected illness without medical debt. It enables you to get and stay well. Coverage is the doorway to life-saving cancer screenings, to primary care, and medications to manage chronic conditions. As we approach our December 23rd deadline, we want to be sure that our enrollees and applicants have access to the information that they need to make the right decisions before our deadline in order to keep covered. Our Get an Estimate tool is a good starting point to begin planning for your coverage for next year. For our current enrollees, the tool can quickly provide details on available plans and premiums, and also the quick flexibility for users to adjust information to see how changes in information can change eligibility for financial assistance that may affect what you pay each month. For people who need coverage, the tool is an easy-to-use way to quickly see what might be available for help paying for coverage. About 80% of our members get help paying for coverage, so there's a good chance that a new applicant is going to see options that can be affordable for them. Understanding the unique supports that we are so fortunate to have here in Massachusetts, despite the reversals we are seeing in DC, is critical. The Get an Estimate tool is available at our website, right at the top of the homepage, mahealthconnector.org, and a prominent link is near the top of our page for providing information about federal changes for our members. That's at mahealthconnector.org/updates. Once you have the information you need, Please do not hesitate to reach out for help completing the application or finalizing your plan selection. You can reach out to our customer service team at 877-MA-ENROLL or find free help through one of our 50 Navigator locations. You can search for Navigators in your community on our website by going to Help Center off the top of the homepage. If you do want help, do it now, before the deadline when we are at our busiest. You can gather your information, review your options, and have a plan in place, and then finalize your enrollment near the deadline on December 23rd. While we do everything we can to give Massachusetts residents clear information about changes resulting from federal policy and options to stay covered, we continue to implore policymakers in Washington to do the right thing and extend the enhanced premium tax credits. As the governor said, tomorrow I will be in Washington before a Senate panel urging senators to vote in favor of an extension on Thursday. I will be sharing details on what we at the Health Connector are seeing and hearing right here on the ground in Massachusetts as the harms of inaction bear down on hundreds of thousands of residents. For the people we serve who depend on enhanced premium tax credits, this issue is not a remote political debate. It is a gut punch to those trying to make ends meet and trying to maintain their health and their financial security. We do not have to go backwards like this. Thank you again, Governor Healey, for powerfully adding your voice to this vital moment. Now is the time for action and an extension of the tax credits.
Thank you, Director. Okay, and we'll make sure that we get everybody those details again on the website and the telephone number. This is something that is so devastating for Americans around this country, including here in Massachusetts, and we're going to do everything that we can to protect people's access to health care and to try to keep it affordable. But at the end of the day, what needs to happen is that the President and Congress need to act, and they need to extend these premiums so that people can continue to access care. They're happy to take any questions on topic.
I think there are national estimates, but I'm curious if you guys have a Massachusetts-specific estimate for how many people may drop connected care coverage because of costs.
Yeah. You want to speak to that, Director, about what we've seen already?
Sure. So we don't have an estimate for a total loss just as a result of this policy issue. This, combined with the so-called One Big Beautiful Bill Act, we have estimated that hundreds of thousands of individuals across Massachusetts could lose health coverage through the Health Connector and Mass Health. I will say that just in the first month of open enrollment, we've seen over 10,000 people terminate their coverage for 2026. That's double the amount of people who terminated by this time last open enrollment. So it's certainly a signal that people are looking at these price increases and are deeply concerned.
Also, can you speak to, aside from basic credits, how open enrollment is going compared to last year? Do you have the stats for how many people have signed up?
So we have continued to see new people sign up for coverage, which is really important and encouraging. So we're out across communities, all across the Commonwealth, making sure people who don't have coverage know how to sign up and know the dates about open enrollment and the availability of navigators who speak dozens of languages. We have 50 locations across the state. So all of that on the ground work, I think, is going very well. We're seeing a lot of activity in our call center and through our navigators. So people are clearly engaging with the issues. And for many people, they are signing up. But we are seeing some of the folks, as I mentioned, who are seeing the worst premium increases or are losing subsidy altogether as a part of the so-called One Big Beautiful Bill Act, trying to reckon with those choices, and many of them are making the choice to drop coverage.
Do you think it'll average out to more people covered than last year?
It's hard to say at this point because there's always ebbs and flows with new people coming in and then other people terminating coverage, so we don't feel ready to make any projections about where we'll be on the other side of open enrollment. Right now, all of our focus is on making sure people understand what's happening, what the impacts are as a result of federal changes, how to get help, and primarily how to stay covered despite these headwinds we're getting from DC.
So right now there is a bipartisan congressional effort to extend the tax credits, but the fact that you're speaking out today, does that show some, I don't know, not so much confidence that that's guaranteed or that there will be a deal reached?
I'm speaking out today because Congress and the President need to act this Thursday. They need to act to end the misery for so many people around this country who are at risk of losing their health care. They need to act Thursday. I'm speaking out, demanding that the President and Congress take action, vote to extend these credits so that people can continue to access health care in this country.
Governor, there's growing evidence that young people are becoming addicted to sports betting. A few weeks ago, Ohio Governor Mike DeWine said he regretted legalizing sports betting in his state and actually now supports rolling it back. I'm wondering, do you think Massachusetts made a mistake here by legalizing sports betting?
I think it's something that's really concerning, Chris. I mean, I've long been concerned about the impact of sports betting on young people, particularly people in college and with respect to college sports. So I think it's something that bears looking at and making sure that in the first instance, everything is being done on campuses and elsewhere to educate and to prevent sports betting addiction. And I also think that whatever leagues and others can do to crack down on this is really important. But I think it is something, for policymakers to take a look at just generally across the country. I mean, what's happening in this space? The last thing that I want to see is young people addicted. And so, what's come out and the data is concerning. And, I think there are probably ways to deal with that. I don't have the answers, but I think it is something that policymakers across the country should be looking at, in the wake of data that's come out.
Thanks, everyone.
Separately,
Great. Thank you.
you guys struck down an executive order on wind projects, blocking them here. What do you think of the wind industry now here? Are you still behind it? Do you think it's still something that Massachusetts
Yeah.
can back?
I mean, look, as I've said before, I'm for all the above when it comes to energy. We've got to get as much energy into the region as possible so that we can drive down people's costs. And that's what we've been trying to do as an administration. I continue to support the wind industry, which, by the way, is powering, as we speak, wind right now is powering 250,000 homes and businesses because of Vineyard Wind and the turbines spinning off the coast of the vineyard. So I am very pleased to see the court's order yesterday. I'm grateful to Attorney General Campbell and to other AGs in states that joined in this effort to fight for our residents. That's what we're trying to do. We're trying to make life more affordable for people by bringing more energy in and lowering costs. And wind is a part of that picture, so I continue to support the wind industry. We've made a lot of investments in the wind industry. There are a lot of great jobs associated with the wind industry, and importantly, it's a way to bring in more power and lower people's costs. Thank you.